Okay, so we're going to go ahead and get started. Hello and welcome to iTeniv's webinar. Today will be a presentation on a sneak peek of the EHR enhancements in NextGen 5.8 UD2. This is the 8th installment of our educational webinar series, and we hope you find it interesting and beneficial. My name is Chelsea Lukens, and I'm the Marketing Communications Coordinator for iTeniv. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. Pleased to announce that we're going to be doing a webinar on the EPM side of things in UD2 Enhancements, and that's going to be on April 2nd, noon Eastern Time. A few days after that, on April 7th, we're going to be presenting a webinar on evaluating your practice's financial health. It should be an insightful one, and we hope that you join us for it. So, at the end of the presentation, we're going to open up the floor to questions from you. We'll answer all the questions at the end, but you may type them in the questions area of the webinar control panel whenever they occur to you. Finally, for audio clarity purposes, everyone's phone is going to remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters today. First is Cynthia Kincaid. She's the Vice President of Consulting Services at iTeniv and a Certified Practice Management Executive. She has over 25 years experience in the IT healthcare industry and 8 years with iTeniv. Her experience runs wide and deep. She's not only a senior executive at iTeniv, but she lives and breathes the industry and travels across the country seemingly nonstop, working with our clients at their locations. This makes it possible for her to provide the insights needed to help healthcare organizations experience great success no matter what the challenge is. Also, Jordan Nurswick will be available to jump in with additional information and answer your questions. She's been with iTeniv for almost 3 years. She originally joined us as an intern while she completed her degree in Health Information Management Systems at The Ohio State University. Since then, she's really become a true NextGen expert and has fully immersed herself in the UD2 enhancements. So, Cindy, I'm going to go ahead and pass the webinar off to you. Feel free to get started when you're ready.
Okay, great. Well, first of all, welcome everyone. We're very excited that you have decided to join us today. We are going to be taking you through, as we said, a sneak peek of the UD2. We have been working with one of our clients on a beta agreement, and we have been taking through this, and we've been looking at it. We're very excited about some of the features. We will not be able to cover all of them because this is a very intense upgrade from the standpoint of enhancements, features, and even defect fixes. We're going to be focusing on EHR only today. As Chelsea mentioned, we will be following this with an EPM webinar to take you through that. So what we're going to be covering today is the agenda. We will be talking about when, what, why, who, and how. So as we go through this, we'll talk about when the upgrade is available. And as it stands right now, the 5.8 UD2 expected release date is April 22nd, 2015, and that's looking really good based on our beta testing. We may not have our client in production by then because we've also been testing the KVM 8310, and we're excited about that as well. However, everything we're hearing and what we're seeing, this is the release date, and we're looking forward to getting it out to many of our clients. As we move through, so why? UD2 offers many enhancements and new features to benefit your clinical staff. We, as I mentioned, are very excited about the things that are included in this release. It's not just as you've been focusing on meaningful use or ICD-10 or many of the releases that NextGen has had to focus on in the past. This one is really looking at some really valuable aspects that we can share with you. So some of the EHR enhancements that we'll be talking about are enhancements to the medication module, the medical summary utility, the allergy module, quick view documents, very excited about that one, patient registry, the order module console, alerts, can't wait to show you that either, the communication component, and the new workflow module. The way we're going to go through this is I'm going to take you through the releases, and then we will be showing you screenshots from many of the functionalities that I'm talking about. So first let's talk about the medication module. The medication module, we have drug-to-drug condition interaction codes now includes SNOMED. Mapping behind the scenes will prevent duplicate alerts if the patient has both an ICD code and the equivalent SNOMED code. Interactions can be checked in the medication module and the problems module. In medication favorites, you can now save units, and we'll talk more about that in detail as we get into the samples. And they are now also added the ability to copy provider favorites utility. There are also some ERX window formatting changes, bolded sections, authentication section is reworded and disabled unless the ACS eligible pharmacy is selected. So basically many of the benefits to this area is that we've done some things with patient safety. The saving units is going to be truly well received by your providers, and the formatting changes just make the screen easier to look at. As part of the medication module, there is now the Patient Savings Program, and NextGen has partnered with LDM and is no longer using PDR for this service. I don't have a lot of clients who have used this, but those who have find this very valuable. Basically how it works is when a prescription is printed or sent, data gets sent to the LDM in order to determine if savings are available. If it is, or if they are, the results are returned to EHR. A code will then display on RX print, fax, and ERX, and the code will be returned to the pharmacy. In addition, script guides, or similar to patient education, can be printed with medications. This is similar to the monograph feature, although it's not replacing it. In the event that the pharmacy does not receive the code, the e-copay coupons can be manually printed. This service can be enabled through NextGen Communication Services and requires setup in practice preferences and user preferences. The medical summary utility has some enhancements associated with it. First of all, it gives you the ability to set sensitive data exclusions for CCD, CCDA, exports to the patient portal, NG Share, EHR Connect, and any other application that sends the CCD, CCDA. These exclusions can be set for medications, diagnosis, problems, and procedures. This particular functionality is huge. For those of you who are actually sending CCDs out through the portal or through NG Share, we've had many providers request the ability to take certain sensitive information and exclude it. And while there's certain ways you can do that on a limited basis, this functionality really adds that capability, and it's going to be very important as we continue to use those functionality in documents. It also provides the ability to associate a KBM referral order with a transaction when sent via direct messaging. The ability to validate that messages sent with a direct address has been added. And what that means is that before you could send the message, but you really didn't know if it had been received, they've now added the ability to validate that the message was sent. And attachments for CCDA now include ICS images. The Allergy Module. The allergy reactions now include SNOMED-coded reasons. The user can enter up to 5 reactions per allergy. These reactions can be edited, added, removed, and reordered. That's a really great feature and is going to be very well received. On a locked encounter, the onset date, severity, reaction, and comments can now be updated. Quick View. Quick View is a new function that allows the user to preview items on the master document as they enter the data. NextGen showed this in the opening session at UGM, and now that we're seeing it in action, it is really going to be so great. For those of you who work with providers, they always have to go out, preview the document. If they need to make changes, they have to go back in and edit it. Now what you can do is you can have a hide show function. It's similar to the navigation bar. It sets across the side, and as the physician is doing, the quick view refreshes when the template is saved. So this is a user preference turned on and off from the view menu, and we will have some screenshots of that later. The patient registry. There will be a function to create a patient registry for items that need follow-up. This is almost, from my perspective, and I don't want to confuse it, almost like a patient dashboard where you can base actions are based off of results from memorized reports. These can then be used to follow up on patient portal messages, referrals from NG Share, population health, and patient recall plans. It uses the EHR reporting tool, and it provides outreach communication that can be tracked. The registry can be generated offline, and it's accessed as a practice template KBM version to be determined. So this will be generated in a future KBM as well from a practice template. The one thing that I wanted to mention is this: as we move to a value-based model in healthcare, these type of services and solutions that NextGen is providing are bringing us more use from the data that we've been capturing in EHR, and I think it's just really headed in the right direction, and really excited about this one as well. The Order Module Console, Order Enhancements for Lab and Radiology. The user can now modify the expiration date on future recurring orders. Timeframes can be set in practice preferences. What this allows you to do is you can set an expiration date, and we've been working with a client that is very involved in the order enhancements for lab and radiology. They've used future orders since it first came into effect in UD1, and these enhancements are going to be very beneficial to them. What this allows you to do is that before it was kind of a generic, you could set expiration dates, but now when you've got recurring orders, different tests require different things, and so now you can set these time frames and practice preferences. There's an auto release for future recurring orders can be set to auto send through a set schedule. This involves a new application, lab auto release, and it does require some configuration. We're just working through this, so I don't have the ability to answer a lot of questions on this yet as of now. However, based on reading it and understanding the functionality, it looks to be able to allow you to create a set schedule, things like OB and different things, and you can auto-release some of these orders associated with it. There are enhancements on the orders console practice template. Filters can be set on orders for performing entity, provider, location. So what this also allows you to do is from a follow-up perspective, you can now add the entity, the provider, and it has system follow-up. And I don't know how many of you on the call are using the future orders. This functionality makes it much easier and much more streamlined and works much more effectively. So we went into phase 1 in UD1, and now we're enhancing it and bringing it better and more user-friendly in UD2. Orders can then be tasked to a user or a group. Alerts. This is another area that I think everyone on this call, if you aren't aware of it, will be so excited to see. There are major changes to the alerts template. First of all, an alert screen will automatically open when the patient's chart is opened if there are alerts. User can view EHR and PM alerts. Important alerts can be set to view in red, bold font. Alerts can be flagged for acknowledgement by all users or by the provider only. Hovering over the red alerts button on the patient toolbar now previews the alerts similar to the medications, allergies, and problems on the patient toolbar. Medication alerts can be added from the alerts template. Any medication alert added can be viewed in the medication module. That is huge. And in looking at this and testing it, it's just really nice because now you can put an alert in about a medication at the time you're documenting the intake, and it will automatically move over to the medication module. And in the past, there was really never a good way to be able to see those. Old alerts in the system will be moved to new formatting during the upgrade. Practice alerts can be set in configuration, and comments can now be added to alerts. The benefits to this, I can't say enough about, and you'll see more when we do the screenshots. This really does provide increased functionality that so many physicians and providers and anyone working in the EHR has been asking for a very long time. And the fact that it's now in there, it really shows a change in workflow, and you'll see some of that again when we get to the screenshots. The communication component. This is a new communication function that incorporates many of the same concepts as the telephone template. The communication module is actually a component field in the template editor. This will be added to a template in a future version of the KBM. Then what it does, when actions are needed, it integrates with other parts of EHR, an example, refills medication module. So when you've had an action that you've identified that you need to do a refill, you can actually do it from the communication component. Communications are divided by call type, an example, medication management, medical questions, etc. And specialized template displays based on the communications call type. And you can use my phrases in the communication component. This is completely new functionality, and I am not as familiar with this, and Jordan and I worked quite a bit on trying to download this and get this in a test environment. We will be talking about some of the things that we went through when we went through the NextGen education on this as we get to the screenshots. However, I probably won't be able to answer as many of your questions because we're still also in the learning phase on this. I still wanted to include it simply because I think it's a really important functionality, and I think it just demonstrates the added features that are being made available in UD2. And finally, in terms of what we'll be talking about today, or at least one of the major things we'll be talking about, is there is a completely new workflow. It's a completely revamped inbox. The workflow and PAQ are now combined into one provider workbench. The PAQ functionality remains the same. It is just integrated into one area for easier access. Clinical tasking. There are now tabs for inbox functions. An example, PAQ, tasks, appointments, rather than divided space on one page. So what this is, and probably badly worded here from my perspective in typing, is that it's all, you're able to jump from one place to the other, and you're able to do it very easily and streamlined in a single workflow. The user can now filter tasks, and when users select the task will show side by side with the task details and the patient's demographics. Viewing this information is possible without opening the patient chart. And again, when we've been doing our testing in this is the one area that really came up and worked, I don't want to say flawlessly because we've been going through testing. However, there was no work to do it. The new workflow is just there, and everything moved over. And really excited about the way it looks. Appointments, there are 3 different appointment views, daily, multi, and timeline, and we've got some samples of that in screenshots as we move forward. And the user can view individual appointments as they bring them up. And again, we'll kind of show you that as we work through the screenshot. So now that I've went through and highlighted the various things that we think are there, again, we haven't covered all of them, let's take a quick peek. So first what we're going to talk about is the ability to save units and medication favorites. This may not seem huge. However, from our perspective and the things that we have had as we've been looking at medication favorites and trying to get physicians and providers to use those, they really made it hard because you could not save these units, which made it a multi-stage process, and ultimately a lot of the providers we work with just simply didn't use it. So what you can do now is that you can now, as you create your medication favorite, you can simply save the units. So here's the units, and if you move down, you can see the example of the units, millimeter, and that will now be saved so that when they are prescribing this, it makes using the favorites a very feasible and easy operation. And from our perspective, when we were talking about this, this actually is something that probably makes UD2 worthwhile on its own. As we move forward, you heard me mention talking about the patient savings e-coupon. This is basically a coupon information will show in the comments box of the prescription. So if you are subscribing to this program and you have worked through it, you will basically be able to go out as we described and take a look at this, and this is an example of the coupon that will come back. Script guide, again, we mentioned that as we were going through the features and functionality. The medication script guides can now be viewed, printed, and sent to the patient portal directly from the medication module. This is an optional, and again, it is part of the service, so you would have to make sure that you have registered and set up for this if you choose to use this. But this is much like patient education, and here's, again, just an example of one of the script guides. And we got those screenshots from the NextGen presentation as we were going through those because we're just in the process of bringing this up, and it's not something that we can actually deploy on our own. I thought it was worthwhile to show it to you. The next thing we want to talk about is accessing the quick view. So we're going to take you kind of through the quick view. So here's how you access it. Once you have it set up, remember you can turn it on or off. You'll see that an item on your side, which is a quick view bar. Then you can do your summary view and your quick view. And you basically click these and you will be able to move forward and bring it up for the provider. And then as you are documenting, it will show on the side, as we said, almost like a quick view panel and the EHR template. So as the provider is documenting, the way that the document is going to preview, we'll see over here. So he can actually see the verbiage as he's doing it without having to generate the document in advance. Great time savings, because if you are sending your documents to the offline document processor, then what happens is that they either have to wait for that, or if they generate them in real time, which many of the practices do because they want to see that before they actually exit the visit, this will now save them the time because they will be able to see this. Again, another feature that I can't wait. There are some sites that I think when we show this to them, they're really going to be so excited. And I think another feature, standing on its own, makes UD2 worthwhile. The order module and console. So as the order module, we talked about the future date. So you can do a future order one time, and that's where this is the area where you would set a date for the future order or a schedule for recurring orders. Expires, you now have the ability to edit the expiration date, so you can do it in days, weeks, and months. It's, again, for a specific, you can set your order schedule for a test, and then you can set a date for automatic release of the order. All of these are new functionality associated with the order module console, and for those individuals that are really trying to track orders and the fulfillment of the orders, this is very well received technology. And now alerts. I think you heard me mention that I was very excited about this one as well. Now when you have the alerts, what you can see is hovering over the alerts button on the patient toolbar now previews the alerts. It's similar to the medications, allergies, and problems on the toolbar. So if you take a look, you can see the type of the alert in red. You can see the type and the alert. So it's a chart alert, a communication alert, or prescribing alert. So maybe here no refills, hearing impaired, or blood pressure. Medication alerts can be added from the alerts template and then viewed in the medication module. So here is an example of the prescribing alert that we had, and it says no refills. So we took screenshots from both of you those to see how they are impacted. The biggest item that I've had is for those of you who have worked through this, is saving keystrokes. It's huge movement in workflow, and I know that each of you who worked with your providers or worked with EHR have heard the complaints about alerts. I think this solves all of them. At least I hope it solves all of them, because honestly, this is just something that I think is really well-needed functionality, and I'm so excited it's finally included. So here's your Edit Add Alerts screen. So if you need to edit or add an alert, it includes EHR and EPM alerts. You can enter comments for each alert, so if they want to make notations. The alerts can be set to show in red and bold font. Alerts can be set to require acknowledgement, and you can make that an acknowledgement based on their user type, so provider only or all users. Now the nice thing about the acknowledgement, that when we were discussing this and preparing our training for our groups, is that for very serious alerts and things that are important, such as in an OB-GYN office, a latex allergy, now that's always, there's been steps for that, but something like that, you can actually set the acknowledgement so that you know the provider has seen it, because they have to acknowledge it. And if they're in a hurry or they are focused on the patient and not really looking at the screen, we all know that everyone is human and they can miss things. And by adding the red, forcing the acknowledgement, this gives you an added patient safety level that has not been available in the alerts before and has been requested for quite some time. And once again, as I said in the beginning, very excited about this functionality, because NextGen is finally being able to focus on workflow and the provider experience as opposed to regulatory compliance and things. And UD2 is really about taking it to the next level. The patient alerts notification. So when a patient chart is open, the patient alert screen will populate for the user before beginning the documentation. So basically, as a note, the alerts on the screen will reflect the alert setting as a user has selected on the Add Edit template. So what we did before, this is how it's going to determine how the alert will be seen. The communication component. Again, we mentioned this earlier, and this is another area that's relatively new. What we did, and borrowed these from NextGen because we do not have this fully set up in our test environment yet, but basically this is a sample of the communication component. So what you're going to see is you will have the ability to set these in sites, billing question changes, form requests, medical requests, medications, etc. And this is how you can select the call type when you're setting up the communication component. And then this is an example of where you will put the information in. So you can create a new task. You can attach the category as a telephone call. It's incoming by urgency, so you have your new task that you can send out, and as I said, move this forward. And on the side, you can see the call information, the contact information, the concern, the actions, and the call status. So once again, they did touch on this a little bit at UGM, and moving forward, this is really an area that we're excited to see how you can basically, again, improve workflow by being able to send all of this information based on tasks, send out group follow-up, get your tasking going, and again, just making the workflow more effective throughout the practice. And finally, the area that we are very excited about, and we spent the most time on the screenshots because I think this is something that the providers are going to be actively excited about the moment they see it. And it just actually flows. You really start your UD2, you do your test, you do your upgrade, and this is really effective. So let's just kind of talk about the new workflow. We'll start with the tasking tab. So as you can see, clinical tasking, appointments, provider approval queue, patient portal, those are your navigation tabs. This actually comes up and everything will be there for the provider in one place. You will have your task, and it's a summary of user tasks. And as you highlight them, it shows you the number of tasks, and then here you see the task in a list format. You see your list of appointments. As you go down and you highlight your appointments, you can actually bring up the patient, and we'll be talking a little bit about that as we move forward. Here are your patient medical questions. And you can do new, update, or organize. So it's a preview panel to view the selected task. So as you highlight Test Evelyn, or as we highlighted Evelyn Test, you will now see that you've got your task information, and you will see who it was from, who it was sent, and who was the person who was doing it. Off on the side, you have your active patients demographic panel. So again, as you have your active patient, so once again, Evelyn Test, you will see that without having to open the chart, you can now hover and see the alerts, the allergies, prescriptions, diagnosis, and medication. So all of the things, or problems, I'm sorry, my eyesight, allergies, problems, diagnosis, and medications. All of those are there and available for you to hover over so that you will be able to take a look at exactly what's happening. So as we move through the new workflow Appointments tab, Daily View. We take a look at the Appointments display options. You have daily, multi-timeline, so we're going to be focusing on the daily view. It shows you, once again, the list of the patients of their appointments and what their status is if you're moving through the status. So in this case, all of ours are just in the book status. However, there could be, rooms and wherever their status is. As you highlight them, you can basically see the appointment and the detail of the appointment there, and you can update, go to the chart or orders. Once again, active patients, you can see all the allergies, problems, diagnosis, medication, so you can actually hover over that before you actually move in to see the patient. And then you actually have an active calendar to view appointments on other dates. May not be work very well when you're actually seeing the patient, but if you want to take a look at tomorrow, you can simply do that right from your workflow module. We change the new workflow appointments tab to the multi-view. What you will see then is you will see a list of multiple providers. Very helpful if two people are working together. If you've got a nurse working with multiple providers, they could actually see how they're moving aside. Or if you're working in an approval status with your nurse practitioner, you could do that. Again, just a different way of seeing things. And it's a calendar view of daily appointments when multiple providers are selected, which showed two different areas. Finally, as you highlight your patients, you have the same options with the active patient that you have on any of the other screens. The Appointments tab, Timeline. Once again, now different view, 3 view options. The Timeline view shows appointments in a horizontal layout. The scroll bar moves left to right to view time slots opposed to the daily and multi-view, which are viewed vertically by scrolling up and down. All based on preference. This one to me was not something that made it easy for me to look at. However, when we were viewing it, some of the providers that we've trained and as we're working through the beta process like this, the beauty of it is it allows the provider to see it in the way that works best for them. And finally, as on all the other screens in workflow, and I can't hit this enough, you still have the ability to hover over the active patient that you're looking at that time and see the pertinent information without having to go to the chart. As we move to the new workflow, the provider approval queue. This is something that providers have been asking for. I don't know, I guess PAQ, it came into existence. It's really they had to go to a different area. It wasn't that hard, but it was extra keystrokes. So now if you highlight the provider approval queue, what you can see right there on this workflow screen, so perhaps between one patient and another, you could quickly jump on the provider approval queue, take a few looks, and move out. So you have the tabs to view current, pending, rejected, historical items in the PAQ. There are now a list of items in the PAQ. And there's a drop-down list to filter items on the pending list. There is some added functionality associated with this. So you added a note function buttons to accept, reject tasks, and go to the patient chart. Again, all while we're in workflow. And finally, the panel to view selected documents, labs, or images. So you can bring the panel in and out. Now we have the new workflow patient portal tab. As you recall, the patient portal was actually listed as part of the toggling between messages and everything in the new workflow. It's actually a tab at the top. You have your patient portal, and you can work through your patient portal and respond to your items. And once again, the same functionality as you highlight your patient. You will now be able to see the patients and bring the active patient up, and you'll see the information associated with that particular patient and the information associated with them. Those are the features of UD2 that we've chosen to highlight as I mentioned at the onset, we will be continuing these webinars after it becomes general release, and we will be talking about the fact that there are more functionality, giving you more details. We want to make it as available to everybody as possible and make sure that everyone understands the need for UD2, what its impact is, and why we think it's important that many of our providers move forward with it. So who does UD2 affect? It affects all EHR users. You have a setup team. There's file maintenance, system practice templates, etc. will need to be configured. When you plan for UD2, you don't have to take everything at once. Some of the things will happen immediately, such as the new workflow, because the workflow has changed. I don't think there's a lot of training associated with that. However, some of our providers don't like change, and so they need to be made aware of it. There are other items, such as the communication component and different functionality, that you don't have to take right away and you can ease into. That really has to be a decision by your setup team, because once again, file maintenance, system practice templates, etc. will need to be configured, and you need to determine what you want to use and when you want to start it. Providers and clinical staff need to determine and understand the changes that will impact their workflow. The new workflow module, I think, is easy to understand. However, it might make some changes in the way you do things. The other items with the alerts or the ability to do some multitasking or sending tasking from some of the new functionality associated with the features we've shown, you may want to take right away, get them set up, and let people know. The future orders, that actually could have a direct impact on workflow. Finally, the management. Training of new features and enhancements will be necessary for all clinical users, and the level of training that's required may have to be varied depending upon which features you choose and what the timeline is that you do them. So how do you do it? Well, you do it with a plan. This is a major upgrade in my opinion. I don't know that it's significantly hard from a technical perspective. For those of you on the call that may be actually performing the upgrade and, you know, the actual functionality of the technical aspects of forming the upgrade, but it has a lot of features. There's a lot of functionality in this. There's also a lot of defect fixes. It's been planned for a very long time, and NextGen is working diligently from a testing perspective to make sure that when you get this product, it is as defect-free as possible. And I think that with the efforts we've been participating with and the projects that we've been involved in, they are achieving that. So how with a plan? You want to find your major participants. What's the scope? Again, which features are you going to be using? What are your objectives? How are you going to measure your success? And you want to talk about any assumptions and restrictions. And then a project manager. Typically, whether you're small or large, someone has to manage the project. And I think all of these are very important as we move through in setting up and preparing for UD2. So what are the basic steps to upgrade? Regardless of whether you want to have a full-fledged project plan, you're a large group or a small group, there are some basic steps that you need to consider in this upgrade and in any upgrade. You want to validate your features. What are you going to use? You want to develop your project plan based on what you've decided to use. Determine the requirements. What kind of staffing requirements do you have? What type of training requirements do you have? Do you have any equipment needs? Again, depending upon what version you may be coming from, if you're already on UD1, you're already at a compliance from a hardware perspective, and a network perspective, if you're coming from a lower version, it might require some hardware upgrades as well. You want to run a test upgrade. Then do all of your setup in the test upgrade, and then test, test, and test. Make sure when you're testing that you include all of the stakeholders associated with the project. We all know it's hard to get our providers involved in testing. It's hard to get the providers interested or enthusiastic. With that said, it's important, if at all possible, to at least have a provider champion or someone representing the clinical team to be involved in the testing. And last but not least, depending upon whether you're using whatever amount of features you're using, whether it's small or not, make sure you have the ability to train, and train again. I can never emphasize training enough, and I know, once again, having worked with groups, we're all in the real world, it's almost impossible sometimes to get your providers to give any quantity of training. They're working hard. It's not a criticism. It's just a fact that it's very hard to find the time. So work really diligently to see if you can work that in. And finally, go live. Those are the basic steps. And we can help. Many of you are independent and you have people in place to take care of all of these things. If you're not or you're uncertain, we can help, as can NextGen. How we can possibly do it is if you feel uncertain about next steps, we can help by providing an EHR workflow assessment with an on-site consultation. I'll give you a moment just to read this. This is something we've been doing with great success. We're currently offering a 3-day on-site assessment that includes the workflow analysis, planning, written report of findings and recommendations, and this includes all travel expenses if you are interested in pursuing that. As we move on, if you have any questions about the on-site assessment or our presentation today, let's talk about the questions. And I'll open it up right now and leave my name and address, and both myself and Jordan will be able to answer the questions that we can. Again, keep in mind this is a new version, and I will do my best to answer anything you might have about it. And otherwise, we'll do our very best to make sure that we get you covered or get back to you if I can't answer it.
Okay, thank you, Cindy. That was awesome. Looks like we have a number of questions that are already pouring in. And just a reminder, you can ask your questions using the question panel on the GoToWebinar control panel. So first question that we've been getting, and I'll go ahead and field this one. A lot of people have been asking if they can get a copy of the slides. If you're interested in getting a copy of the slides from today, please email either Cindy or Keith. Their email addresses are up right now, and we would be happy to send them to you later. Also, we're going to be putting a recording of this up on YouTube, and so you can find that by going to our YouTube channel, or in YouTube search box, type in iTentive, and you can see all of our recorded webinars there. Okay, next question. Will the patient portal inbox function as the tasking inbox currently does? Example, when a task is accepted from another user, it will be removed from the other user's inbox? Currently, the patient portal inbox does not function that way, and it's confusing for several members in the same group.
To my knowledge, that functionality has not changed. I will make a note to test that, and if you will drop me an email with who you are, or Chelsea, if I don't know if we can do that, I will get back to you. I do not believe that functionality has changed. I just have not tested that specifically.
Yep, and we have that information, so I can give that to you after the presentation, Cindy. Okay, next question. Workflow question. For medication refills at UGM, it was demoed that the med refills can be performed within the workflow window. However, can the provider approve and send via EPCS refills in the same window as well?
It is my understanding, yes.
Correct. Any changes for ICD-10?
No. Not that's associated with this or anything that we found. Now, I mean, we do have the SNOMED codes and those kind of things, which is all kind of tied. It's not really ICD-10, but it kind of ties around as you link those, and there's some improved functionality as you're linking codes. But there's nothing that, technically UD1 made ICD-10 ready. I haven't read every defect fixed. I will admit I don't have those committed to memory, but there's no functionality changes for ICD-10.
Okay.
In EHR, I want to clarify, in EHR, we'll be doing the EPM presentation, and that's something we'll get into when we do that. I do want to clarify I'm focusing on EHR right now.
And the EPM one will be on April 2nd at noon. Another question. Do you have an estimate for the needed training time for providers?
It's really going to depend on what features and functionality you choose to deploy. I don't think it's going to be significant. I mean, when I say significant, like if you were getting a new release or something, the workflow module is great. If you get into some of the new functionality for clinical modules, alerts is minimal. We talked about the fact that you can now save units. The providers will have to be changed about that. I'm thinking 4 hours. Again,
okay.
It's varied with what you try to deploy, because you don't have to deploy everything.
Right. Next question. Will Outlook still be integrated?
I have not seen anything that says Outlook cannot be integrated. I'm going to be honest, that's not something that we have technically encouraged our practices to use, simply because of some of the HIPAA requirements and things. Now, if you have your own Outlook, and again, larger organizations have different functionality, I have to be honest, that's not something I have tested at all, because our beta group does not have Outlook integrated today. I haven't read anything or given any indication that it is no longer integrated. And I'll make a note to ask about that.
Okay. In the new workflow box and using tasking, can you reply to a task smoothly?
I think so. Again, smoothly. That's kind of a perspective, but in my mind, and we were pretty critical about it before. So yes, I think you can reply to it smoothly. I think it's great. I have nothing negative to say about it.
Is the new notes section of the PAQ a copy of the tasks sent to that provider? If so, will working the task remove it from the PAQ and vice versa?
I don't know the answer to that question. I'm not sure I'm following it. That would be something I'd like to check offline. And I don't mean that in a negative way. Sometimes when you can't talk and there's so many people on this call, it's hard to open it up to everybody. I would really like to follow up with that personally so I'm sure I understand the question because I'm not sure I'm following it. And Jordan, if you have any insights or hear something different, feel free to jump in.
Okay, will the tasks in the PAQ be recorded in the chart, or will they still be a to-do?
They are still a to-do. I know that that's a lot of things people want. I don't believe that it has changed to. Now, there's a definition of being recorded in the chart, and I've talked to NextGen a lot about this. Again, there are some things that we can do, but a lot of times the tasks, it's a debate when you talk to people that they want them in the chart, they don't want them in the chart, that the function, the end result of the task ends up being in the chart, and you can still see them. So right now, it is still considered a to-do.
Okay. Next question. Will the quick view functionality work for card_doc visit in cardiology?
Wow, that's specific, and I don't know the answer to that. I don't know the answer to that. I'm going to write that template down. We get these questions, and I will look it up. Our beta site that we're working with is not cardiology. We've played with some of the cardiology functionality, but I can't specifically say that we've looked at that specific template. It's supposed to work as you're documenting a visit, and I'm sure there will be times with certain templates that it hasn't been fully vetted yet. I don't think that there's any templates that they've said exclusively under no circumstances is this going to work. However, I can't test that, so that's a long roundabout way to say I don't know. But I will take a look. I'll get the questions answered.
Okay, perfect, and we'll follow up with you offline then. What KBM version do we need to have this functionality? We're on 8.3.7. Looks like a number of people have been asking that type of question as well.
Our beta site is on KBM 8. Actually, it's on KBM 837, so we'll work with KBM 837. I don't know, again, because we're looking at the beta site, I haven't researched every KBM, and that's a great question, and I wish I had researched it. I think anything in the 8.3 series is okay. Again, I will validate that, and I'll probably just send that answer out to everybody since there seems to be a lot of questions on that. 837 is fine because our beta site is 837.
Okay. Will SNOMED mapping have to be done in the medications allergy modules?
Yes, some kind of mapping will have to be done.
Okay. How does NextGen Share compare to KBM referral? Are they the same and function the same?
NextGen Share is the module that came out from Mirth. You have to be on UD1 to utilize it, and it's a communication project. I haven't personally set it up, so I don't know that I can tell you what it does. It basically is a mechanism for sending referrals as well as the CCD documents and the items that we mentioned earlier. The KBM referral I don't know a lot about, so I don't know if it functions the same way. I can tell you it goes through a NextGen HIS, so there's communication that goes up through NextGen, very much like the portal. So NextGen has made themselves the HIS associated with it, and that's how it works. I really don't know how the KBM referral works, so I can't say that they're the same or not. We've had great success with it. We've been very very lucky with it. And the items that you can now do when you were talking about the filters and being able to exclude certain items and the communications when you were going through the portal, I don't know that that one of the projects that was not mentioned was KBM KBM referral. So I don't know if you will have that functionality in KBM referral.
Okay, moving on. The alerts, will they auto-open in EHR for EPM alerts or just the EHR alerts?
The testing we've done is that they auto-open if you set them up to, in your preferences, you set them up to cross. I'm probably saying this badly, but yes, they open. It's not something you have to do, so you have to be aware of that. If there's something in EPM that you didn't want to come over.
Okay, can you filter between multiple PAQs per provider, as in assign users to multiple providers?
In the workflow. And I'm going to assume the answer
Was that
to
a
that.
question?
Yeah, and again, when you can't talk, it's a little bit hard. I'm going to assume that that's what you mean, that is within the workflow, and I don't think so. I can't say I've tested that, but I don't think so. I know you can set up multiple providers in the schedule and those kind of things, but you have to be able to still, you still link yourself to the provider from the, when you're looking at the PAQ, you still have to be linked to the provider the same way you are today, and that hasn't changed. So I think the answer to that is no, if we're talking about the same thing.
Okay, and if not, feel free to either type in a question or Cindy's email address is up here. Feel free to shoot her the question via email. Next question, how is an EPM alert identified in EHR?
Jordan, do you know the answer to that? I honestly don't. I mean, I could tell when we were testing it, but I don't know. I may have to get back to you on that.
So they're going, this is Jordan, hi, the alerts I believe are going to show up on the same screen. When you open up a patient, an alert screen will open, and the EPM alert should be on that same screen.
But I think the question is how do you tell the difference that it's an EPM versus an EHR, other than just the subject matter?
When I was testing, I didn't see that there was any kind of designation to show that they were different other than the content just as an EPM. But I can retest that and see what.
Yeah, that's kind of what I was seeing. I didn't see any difference, but I didn't see any delineation at all, other than the content. The content would be different.
Okay, you currently cannot create a to-do in PAQ for an HIE item. Will UD2 update functionality to allow?
I don't know the answer to that one either. It's not any of the features that we've shown. I'm going to guarantee we haven't gotten to testing that.
I don't. But I'll test it and see.
Lovely. Do EHR set alerts appear in EPM?
No, I believe they're all. I believe that no. In fact, because there is no workflow there. This is EHR. It's one-dimensional, one-directional.
Okay. We map users to multiple providers as far as PAQ access goes today, using the workflow admin mapping.
Was that, read that again, Chelsea, I'm sorry?
I think it was a follow-up to a previous question.
Right.
I think that somebody was helping out here. We map users to multiple providers as far as PAQ access goes today, using the workflow admin mapping.
Right. I just don't believe, well, again, we will test that. I don't believe that it changes in the workflow, but I could be totally wrong. Who responded that? Because I know there's some NextGen people on the call. If it's a NextGen person, that's great.
Let me cross-check the name. Hang on.
I don't know that it's that important because we're gonna get back to every one of these that we were fuzzy on, because again, as I mentioned in the very beginning, we are testing this as we learn and wanted to give everybody. I know we've had so many questions and so many people excited about this. Thought it was germane to just get it out there and then let you know we'll be following up as soon as it goes to GR and our provider site goes live, and we will be able to live this full stream because participating in the beta test has been very, very helpful.
Okay. Next question. Can you configure the workflow screen to show pertinent panels so users do not have to go to separate tabs to view clinical tasking and patient portal messages?
I believe the question means that can you take the workflow module and change the tabs around so that if they don't have the tabs at the top, and I don't believe there's any configurability to that right now. If we're talking about the same thing, Jordan, from your perspective, it is what it is. I didn't see any real setup for that.
I think it is what it is. You can filter the tasks.
Okay. That's all the questions we have right now.
All right, well, I really appreciate everyone participating. And again, for those things that I didn't know, we really hope to always know everything, but we're always going to be honest with you. We will get back to each one of you and let you know based on the questions that you had. We will address them and probably even, I think in this particular case, since the questions were raised to everybody, we will probably send the answers out to everybody. So it may take us a few days to compose, but we'll just reply to everyone with those questions, with the answers to those questions that was on the webinar, so that you all have the answers to them.
Okay, and anybody who wants a copy of the slide deck, please just shoot us an email. We're happy to share that. And you can follow us on Twitter, Facebook, LinkedIn, YouTube to find out when we're having new webinars, as well as see recorded copies of older ones. It's another way to connect with us. We're always happy to answer questions over those formats as well. And thank you all for joining
before
us
everyone
tonight.
jumps off, as Chelsea's mentioning, the upcoming webinars. No, that's okay. I just wanted to make sure all the questions were done. We will be having some upcoming webinars, as Chelsea mentioned, UD2 PM enhancements. That'll be on April 2nd. And then we have on April 7th, Evaluating Your Practice's Financial Health. That will be coming. And we have constant more that we're planning, and we hope to keep that you find these valuable. And by the participation, it really seems that you do. So we're going to keep them going. And last but not least, we will also be repeating the UD2 and the PM UD2 after general release, and we'll probably be doing it subject-based so that you will see, you know, like the clinical modules, the workflow modules, and we'll go through the whole setup and some of those items as we expand on this. So don't think this is the last one. This was just really intended to do exactly what we said it was, is give you a sneak peek, and hopefully we'll look forward to seeing you in the future.
Thank you, everybody. Thank you, Cindy. Thank you, Jordan. Thanks for attending.
All right. Bye. Have a great day.